Good afternoon, and welcome to the National Press Club, the place where news happens. I'm Mark Sheff Jr., Senior Reporter at Investment News and Membership Secretary of the National Press Club. I welcome you to the club this afternoon on behalf of President Emily Wilkins. Thank you for joining us, both here at the National Press Club and on C-SPAN, for our headliner event with Health and Human Services Secretary Xavier Becerra. We are happy to accept your questions, and I'll ask as many as time permits. To submit a question online, please email headliners@press.org and put HHS in the subject line. For our C-SPAN and public radio audiences, please be aware that the audience today are members of the general public, so any applause or reaction you hear is not necessarily from the working press. It is now my pleasure to introduce this distinguished head table. Please stand when your name is called. Chelsea Ceruzzo, healthcare reporter, Politico. Frank Islam, CEO and Chairman, FI Investment Group. Sean McCluskey, Chief of Staff, HHS. Ian Lopez, Senior, are you Ian? Okay, Senior Reporter, Bloomberg Law. William Pierce, Senior Director, APCO Worldwide, and the organizer of today's luncheon. He's a member of the headliners team. Donna Linewan-Leger, President of DC Media Strategies, past club president, and co-leader of the National Press Club Headliners team. And Donna and I are also co-chair of The Wire, which is the club's almost daily electronic newsletter. At the next table over here, to my left, Steve Ustin, Senior Editor, BioCentury. Casey Wolf, Counselor to the Secretary at HHS. Joseph Choi, Healthcare Reporter, The Hill. Stacy Sanders, Chief Competition Officer and Counselor to the Secretary at HHS. Firdaus Al-Farouk, Senior Editor, Regulatory Focus. And Joyce Frieden, Washington Editor, MedPage Today. On March 22nd, 2021, with the country at the peak of the COVID-19 pandemic, Xavier Becerra was sworn in as Secretary of the Department of Health and Human Services, the government agency charged with executing the nation's pandemic response. In addition to executing President Biden's COVID policies, Secretary Becerra laid out a bold agenda to meet President Biden's charge to build a healthier America. That agenda includes reducing healthcare costs, expanding affordable access to care, confronting the nation's mental health crisis, tackling climate change as a public health issue, and reducing healthcare disparities. Those are ambitious goals. The U.S. spends a larger share of GDP on healthcare than any other high-income country, yet doesn't provide universal health insurance, and life expectancy is on the decline. HHS points to signs of progress. The national uninsured rate reached an all-time low of 8% in 2022, with 5.2 million people having gained coverage since 2020. The federal government recently began negotiations with drug price companies to curb costs for 10 commonly prescribed drugs that in 2022 cost the federal government $46 billion and cost patients on Medicare $3.5 billion in out-of-pocket costs. And in 2022, Secretary Becerra kicked off a national effort to strengthen mental and behavioral health that included increasing the number of health professionals in underserved communities, expanding telehealth services, and creating the 988 crisis line. Today, we are eager to hear more. Please join me in a warm National Press Club welcome to Secretary Xavier Becerra. Thanks for being here, Mr. Secretary.
Mark, thank you very much. Donna, to you and to Bill, thank you very much, and to everyone from the Press Club. Appreciate it, and to everyone who's attending who may not be a member of the Press Club, thank you for also taking the time. If I can just take a moment to say how important it is to recognize all of you who are doing the reporting. As an avid consumer of what you put out, your news, and sometimes the target of your work, I admire and appreciate what you do and how critical it is that you do it right. And so thank you very much. And every time I see another story of another loss of one of your core, it's just, it hurts, not just you, but it hurts those of us who know that means one more city council meeting that won't be reported, one more school board member who gets elected and it's a surprise, but no one knows. We'll continue to hear about the big stories, but it's the little things that go on in life that really do count. So I want to say to each and every one of you, thank you for what you do, and don't give up. On that same note, I know you have lots to cover these days. I have lots I'd like to cover in my remarks, but as I just finished saying, it's sometimes the little things that count. So I've learned that as the Attorney General of California, when I would often have to talk about big news, but periodically was approached with some not so big but not so good news. It is always appropriate time to take a moment to recognize those who serve but usually don't receive coverage. And I suspect because you cover the news, you already know this. This morning we confirmed that 5 of our Marines perished in Southern California when their helicopter went down. I don't know their names. We have not received that. But I do want to take a moment to thank them and their families for their service. And it's those little things that make a difference and why this country really does make a difference for so many people. Difference. What a difference a pandemic makes, right? Life-saving vaccines in record time. We've now launched a global effort to coordinate and share crisis preparation and response in the future. We found out that we have a very porous public health system in this country, and actually we don't have a U.S. public health system, we have 50 public health systems in this country. What I need to tell you about this wild economy and these wild politics, it does give us a chance to reset the dial in America. And so that's what I want to spend most of my time talking to you about, because HHS is absolutely about resetting the dial. And I can't talk about the resetting that we're doing without first telling you why we're at this position, in this position where we actually can talk to you about resetting the dial. Because when you're a country that spends more, as you heard from Mark, than any other country in the world, but yet you still have millions of people uninsured, it makes it very tough. When you hear the stories, as I heard about the couple in New Mexico who had to make a decision after the husband who had suffered a stroke began to recover and had regained most of his movement and his faculties, but still was having problem with his sight on one side. And when the physicians told him, we actually have some medication that will help accelerate your recovery, as they were approaching the time of getting the medication, they found out that their roof was too holy and would not survive the winter. So they had to make a decision, buy the medicine or fix the roof. And you know, the moral of the story, they fixed the roof. Those are real stories, and they hit real people. And so it is important to understand how we're going to reset the dial. And wow, when you think about it, when we reset this dial, it's not because we just chose to, it's because we had just suffered the largest loss of life in an event in what, a century. And it made us realize that it wasn't just at home, but it was everywhere around us, even if we couldn't touch that place that was thousands of miles away. But yet we knew how to reach them, which is something that was not possible 100 years ago when we suffered the last pandemic. And the interesting thing is that we did reach them, oftentimes too late. And we knew how to treat them, but oftentimes not enough. And so we have this opportunity to make some real changes that this pandemic, and quite honestly, more accurately, that this president, Joe Biden, who sees the opportunity to open the chance to make a big change in our healthcare system as a result of this deadly event, he forged that opportunity. And so I want to talk about what at HHS we do, because the mandate we got from the President of the United States was to go big in so many things. Nearly 700 million shots in the arms of Americans of the COVID vaccine. Not a one cost any of those Americans a penny. That's never been done before in the history of this country or the world. National healthcare data shared among all states and the federal government. You may think that's natural, but it's not. Normally, we have to beg states to provide us their healthcare data because there's no obligation for them to do so. Marshall Plan type response to save our jobs, to save our businesses, to save our economy. Genuine negotiations, as I just finished mentioning, globally to work together to tackle future pandemics and global healthcare crises. Undeniable exposure of the weaknesses of our expensive, top-heavy healthcare system, more precisely, of our public healthcare system. Unprecedented measures to take on a broken public healthcare system that would not have been possible without the suffering of life as we saw. It's those measures that I want to talk a bit about because they fall on HHS to enact. Affordable healthcare coverage, $10 or less. I don't know how many of you bought coffee this morning, but you're probably well on your way to spending what today Americans get for a full month when it comes to health insurance coverage. Never in our history have we seen so many Americans who actually can walk through the doors of a doctor's office or a hospital and not cower because they actually can pull out a card and say, I have health insurance. More than 300 million Americans. We've never seen that before. And actually, we saw the uninsured rate dip to close to 7%. At the marketplace that was created by the Affordable Care Act, Obamacare, nearly 21.5 million people today have their health insurance coverage. They have peace of mind because of that law. Now, when President Biden took office, the number of Americans who had ACA coverage was about 12 million. In just these 3 years, President Biden has made it possible for an additional 9 million people to have that peace of mind through the marketplace. And when you put that together with what we've done through Medicare and Medicaid, you begin to realize how important that safety net is. Social Security, Medicare, Medicaid, and now you have to include marketplace as the cleanup hitter for all those great social insurance programs. Lowering prescription drug prices. I don't know if anyone here has diabetes or takes insulin, but you are saving money if you are on Medicare, $35 a month or less for your medication. People were paying 3-4 times that amount. Shingles, I hope you got your shingles vaccine if you're over 55. Yes, good. And if you haven't, I'm telling you, you don't want to get it. It's free if you're on Medicare. And maybe you're not on Medicare, but you should still consider it if you're not quite the age. Free shingles, flu, COVID vaccines for those on Medicare. Limits on patients' out-of-pocket costs so that you don't go bankrupt because you actually use your health insurance. And the biggie, on February 1st, we submitted to the 9 companies, pharmaceutical companies, who have the 10 most expensive drugs in the Medicare program, our first offer on pricing. And they now have 6 months to decide if they wish to negotiate and resolve an issue and come up with a decent price, the best fair price that we can get for the 65 million Americans who count on Medicare. We're going to do that negotiation mano a mano. It will be authentic negotiation, and I guarantee you it will lower the price of some of those drugs. I can't say how much because we have to engage in negotiation. I can't say if all of them will ultimately decide to participate, but I can tell you that when you're paying 2 or 3 times that price that someone else in another country is paying for the same drug, I can almost guarantee you, but I can't guarantee you because we're in court, so I can almost guarantee you that the price that we will negotiate will be lower than the price that you see today for those medications. If we engage in good faith, upfront negotiations, we should be able to tackle this and come up with a fair price. Behavioral health. When 9 in 10 Americans tell you that America is experiencing a mental health crisis, you better be on it. And so the president has asked us to be swift and be bold when it comes to mental health and substance use disorders. And that's exactly what we're doing. And Congress, for the first 2 years of the president's term, helped us by giving us real resources, more money for behavioral health than any president had seen in any 4-year period of an administration. 988 is the result. You no longer have to dial a 10-digit number if you're in a crisis and you're about to take the wrong fork in the road. You don't have to worry where you are. 988, that's all you have to dial. And if you're younger than 30, you probably won't dial, so we give you text or chat. Either way, we'll make sure you get the call. And if you're a veteran, you want to talk to someone who knows your experience, you press 1 and you get to speak to someone who's a veteran. If you're LGBTQ, we've got folks who are professionals ready to talk to you. If you can't speak English very well, we offer you service in Spanish. If you're hearing impaired, we offer you the service so you can get through as well. 988 is working because the president put in more than $1 billion to make it work. In the previous administration, in the last year of the previous administration, $20 million was the budget for 988. More than $1 billion that the president's put in to be the glue to make this program work throughout the 50 states. So it should not surprise you that some 8 million people in this country have used 988 to get help in the last year and a half. Good news that they were able to reach us. Scary news that they had to reach us. But it's there. CCBHCs, or what you think of as behavioral health clinics, certified community behavioral health clinics, now made available to people, not just 9 to 5 when people are working, but 24/7. So if you've got critical needs, you can access someone who's a professional who can help you. Hopefully that helps reduce the stigma that we see when it comes to mental health or drug addiction, because we need people to come forward. Telemedicine, so that you can reach out. If you don't want to go out and expose yourself in public, that you're going in to see a psychiatrist or going into a substance abuse program, telemedicine is now available to so many Americans who need help. We're using our authority as well to secure reproductive health care access for every American who needs it, wherever they are, whenever they need it. We're protecting contraceptive care all the way to the Supreme Court. We're protecting privacy for patients and for providers and doctors. We're supporting and protecting Title X family planning services because we know not everybody needs abortion care, not everyone needs contraception, but everyone needs to have the best care they can for a family. We're supporting maternal health, not just at birth, not just for the first 60 days after birth under Medicaid, but for 365 days after birth through the Medicaid program. Because we know that so many of the incidents that occur with women, fatal in many cases, occur at that time. And we know that for Black and Indigenous communities, the rates of death and morbidity when it comes to maternal health are 3 times that what they are in the white community. And so we're going to go in and do everything we can because we know we're going to save lives. And we're going to add to prosperity for those families that get to go forward. So in this administration, we don't think we can go backwards. COVID sort of changed the dynamic. It gave us a chance to reset the dial. And so we intend to go forward. We intend to build on President Biden's successes. And here's where I want to focus the final parts of my remarks. Healthcare in America is too often on its heels. We pay, as you heard, way too much for healthcare, $4.5 trillion. That's about 17% of our GDP for healthcare, more than any other country, twice as much as some, and with less coverage than many. Our life expectancy, as you heard, dropped because of COVID, but it hasn't yet fully recovered. And so you have countries that are still growing. Indonesia, they outlive us by about 7 years in Indonesia. We still have cracks. We saw them with COVID. We're not just too often on our heels, we're too often too late. When 1 in almost every 5 Americans who died from COVID resides in a nursing home, and only a fraction of the population lives in nursing homes, we have to do far more. But we got there too late to help so many of our loved ones that we thought we had placed in a safe, secure place with quality. And if you think about it, all of this tells us something that is glaring right at us. We treat illness, and we spend a ton of money to treat it, sometimes well, but we treat illness. We don't sustain wellness. We wait, and then when it's an illness, then we spend major dollars to treat it. Now, here's where I always turn to my mom and Frederick Douglass. Both very similar. In my mind, 2 American heroes. My mom, because she would always tell me, "Mijo, es mejor prevenir que remediar." My son, it's always better to prevent than to remediate. Frederick Douglass, well, for many things for Frederick Douglass, but it is easier to build strong children than to repair broken men. Man, do we spend a lot of money repairing broken men and women in this country. Wellness is so easy to go after. Illness is sometimes devastating. And we could save so much money, and we could do so much more, and get to so many more people if we turned our system away from treating illness to promoting wellness. And that's the resetting of the dial for HHS. We want to go towards wellness. If you want to join us in that, climb on board. Food, maybe not all of this, but food is medicine. Food is medicine. A pill does not cure everything. And the more we start to talk about food as medicine, the sooner we're going to have healthier, enriched lives. And at the same time, we're going to save a ton of money. So we're really behind food is medicine. And we want to support it every turn we can with our Medicaid dollars, with our SAMHSA dollars. We want to get behind anyone who believes that every child, regardless of where they live, should have access to fresh fruits and vegetables, nuts and berries, and be able to enjoy the fruits of that without the parents going bankrupt because it costs so much at the grocery store. And so we are going to get behind those like my mom who understand that it is far better to prevent than to remediate. There is nothing like peace of mind when your child is growing up healthy because you're getting to provide them with healthy foods, not the stuff from the local convenience store. There is so much peace of mind that comes from knowing that when your child does get sick, you don't have to fret about what it's going to cost if you have to forego the monthly mortgage or the rent because you're going to go to the doctor or have your child stay in the hospital. There is such peace of mind that comes from watching your child graduate from high school, go on to college, and be strong and healthy, even though you may not have been rich and powerful. And so we want to go there because other countries have proven that you can go there. But it's tough to get there unless we all do this together. And for me, part of that work means not just letting the U.S. have the fruits of all its wealth and leave it here domestically. And so I mentioned how we're negotiating right now a pandemic accord that would address a future global health crisis, another pandemic, whatever might come. It's very tough. But think of it the way you think of the 50 states, because that's the way these negotiations have turned. There's the so-called global south and there's the so-called global north, and never the twain shall meet, they say. But I think we can prove, because COVID made it possible to prove that we can work together. And so there is a strong chance that come May, and I'm keeping my fingers crossed, we might be able to reach an accord across the globe with countries on how we will tackle the next crises that hits all of us. Because you're not safe until I'm safe, and I'm not safe until folks in the other country are safe, and no one is safe until we're all safe. And so the more we get to that, the closer we're going to come to recognizing that it really does help for us to think early and preventatively and do this the right way. And so I am all about doing this. It will not be an accident. We will not be fortunate. It will not be easy to turn the dial, but we intend to, because we're going to be very intentional about all of this. We understand what the consequences are of not moving forward in globally addressing pandemics. We understand what the consequences are if a woman doesn't get access to care after she delivers. We understand what it means when a woman can't access care because she needs to get an abortion. We're going to work this very hard. We're going to turn that dial. And if you join us, I guarantee you, the next time I come and you serve a plate, that food really will be all medicine. And it will be, Don, it was good. I ate it all. But we want to make sure that everyone knows that we can make this happen. We are mission-driven. We are results-focused. And we will get this done because the health of so many people count on it. So thank you very much for letting me come. I look forward to your questions.
Join me over here.
Which one do I take?
You can go ahead and sit here. And you can continue. Can you hear me? Okay. You can continue to send questions up as the secretary and I talk. You mentioned the negotiations. Can you take us into the conference room? Have you sat across the table from pharmaceutical CEOs, and how is that going?
No, I can't take you into it. What I can tell you is that we launched the offers when we were supposed to, February 1st. The companies have until the beginning of March to tell us if they have a counteroffer or if they wish to accept our offer. We will then, if they give us a response and it's to negotiate, to counter, we will have until August until we complete the task. We have committed that we will reveal the pricing by September. And we've also said, by the way, if any of the companies reveal something about the negotiations, then they open the door for us to do so. But because there's proprietary information that's involved in these negotiations, by law, we're statutorily bound to keep it private. But we have done everything we can to provide the public with as much information about this. We set out for folks to understand publicly what the negotiation timeline would look like. We asked for public comment from all stakeholders, consumers, pharmaceutical industry, providers. And so I think what we've done is set the table fairly well. Let the negotiations begin.
You said you guarantee it will lower the price of drugs. How can you be so certain? Those pharmaceutical CEOs are not paid to see their products become less expensive. Why are you so confident?
You omitted the word probably that I added on to that,
Oh.
guarantee.
Oh, okay, maybe I'm...
Yeah, because we don't know what the companies will do or offer. They all volunteered to engage in the negotiations. They were not required to engage in the negotiations. And so it's good that they, by the way, they all are engaged in the negotiations at the same time they're suing us in court. So they're covering all their bases. And I say probably we'll be able to lower costs, because when you take a look at the cost of those 10 drugs, I suspect you could go to Canada, you go to Mexico, you can go to pretty much any part of the world and find them for a lot less. And it makes you wonder why only in America do they cost so much. And we intend to find out through these negotiations.
How important will drug prices be in President Biden's reelection campaign?
How important?
Yes, as an issue.
Well, I know this is top of mind for him. He fought very hard to get this passed in the Inflation Reduction Act, what I always call to folks the President's lower cost prescription drug law, because that's so much of what it did. He was intent on this. Remember, he ran saying on healthcare he was going to lower costs with better care for more Americans. He's been able to check each of those boxes, and certainly lower cost prescriptions is part of that. And certainly you can talk to any American who right now is getting insulin for $35, and they will praise the fact that that's the case. So many of those folks are on fixed income. So it's part of his platform. It has been. It continues to be during his official time. And I can't speak to the campaign side because you'll hatch act me, so I'll let that be.
You can go ahead.
But there's no doubt that the president, I mean, the fact that he has relaunched the cancer moonshot, part of it is trying to find those medications that will help as well. He's dead set on changing the dynamic here. Again, resetting the dial.
Do you think healthcare should be treated as a fundamental right or a privilege, and how does that affect your work?
My mind, no doubt. I look at healthcare the way, well, think of education, think of utilities, think of the basics in life. If we need electricity to be able to run our lives, if we need energy to stay warm, cook our food, if you didn't have access to it, it'd be very difficult, especially if you had to pay the going price. Because chances are then, whether it's utilities, whether it's public education, whether it's the mail, maybe not so much anymore because of the internet, but mail used to be, if you lived in rural America, you would not get free mail. Your utility would cost you a ton of money to get, because the electrical wires, getting them all the way there, or the gas pipes. We made a decision that we weren't just going to let that be done by the markets, because we knew what that would do. Public education, the same thing. Why would we treat healthcare any different? So from my perspective, it should have been recognized as a right a long time ago. Legally, of course, that moves things in a particular direction if you say that it is a legal right. And I understand that, but I think we're getting closer to that day when it's recognized, simply because in practice, it will become universal.
We'll head back to the election, at least briefly here. What is the likelihood that the Affordable Care Act could survive a second Trump presidency?
So you're talking to the guy who helped draft it, who took it to the Supreme Court and won, and who now has implemented it and helped us hit record numbers of people enrolled in the program. So Mark, what do you expect me to say? It's going to survive any legal test, and it's going to win not because of a court of law, it's going to win because of the court of public opinion. And people, just the way I remember in 2009 and 10 when we were going to vote on the Affordable Care Act, and there were hordes of people shouting at us, then the Tea Party folks, they have these signs that said, "Keep your stinking government hands off of our Medicare." And of course, guys, just ironic, right? Medicare is probably the largest public program for healthcare that we have. And so I think they're going to say the same thing. Keep your stinking hands off of our marketplace insurance coverage. Unless you're going to give it to me for $10 or less and a real deal, not a skinny junk plan that doesn't give me anything when I really need it.
The Affordable Care Act signups have reached new highs. Can the government sustain this program as it is currently constructed? Might there need to be some changes in the future to curb costs?
There's always room for improvement, no doubt, and we'll continue to see that. We took care of the cliff that occurred for modest income Americans who were too high income to qualify for Medicaid, too low income to get the, too high income to qualify for the subsidies, and had too much income as well to qualify for Medicaid. And so we tweaked. Now those families have access. We'll continue to find tweaks because people are continuing to tell us how we can improve it. We're standardizing plans because we found that insurers figured out how to really confuse consumers by offering all sorts of plans with a little tweak here, a little tweak there. And Americans just want to know that they're going to get basic coverage and that what they need, they'll get when they need it. And so we're now requiring a standardization of some of the plans in the different tiers. So this way you can compare. And if you want to go off to one of the more exotic plans, you can, but at least you know what the basics are. And so there are constantly tweaks. One thing I hope no one will ever let go of is the Navigator program. The reason we're scoring so many points, hitting so many home runs, is because we're not waiting for folks to come to us. The people who were uninsured were typically folks who didn't know how to get insurance or if they could qualify or afford it. We go to them. We look for the trusted voices, and it's worked. And so the clergy, teacher, wrestling coach, barber, beautician, whoever's trusted in that community, we ask them, will you help us connect with folks? Whether it's on ACA enrollment, vaccines, we ask trusted voices to help us in the community, so we don't wait for folks to come to us.
You mentioned Medicare earlier. Medicare Advantage is under a lot of scrutiny now, yet seniors keep signing up, especially in urban areas. How do you balance making needed changes while still making it attractive to seniors?
Medicare recipients, taxpayers are entitled to get the best dollar out of Medicare, whatever form it takes. More than half of Medicare beneficiaries today use the managed care programs, the Medicare Advantage program, to receive their health coverage. We want to make sure that when they do sign up for a plan under Medicare managed care, that they're getting a good deal. And so we'll continue to make the tweaks. We don't want to see people being denied care because of improper designation of their condition or the need to go through prior authorization. We don't want to see people who go to their plan and find that the doctor they need is not in their plan. And so we want to make sure that people are getting what they expect. And the Medicare, traditional Medicare program has worked. It needs to be tweaked as well. But what we're going to do is just make sure wherever you go, if you paid for Medicare, and you did if you're entitled to it, that you continue to get the quality care you need at that time in your life.
We, of course, have several questions about reproductive rights. HHS has been making efforts to educate hospital administrators and staff in states with restrictive abortion laws regarding when their providers are permitted to perform emergency abortions. How are those efforts going?
Well, we're providing pretty clear guidance, and you need only read the law to understand what emergency medical care is, and we don't want anyone to be confused or persuaded otherwise. The federal law says that if you are in need of emergency medical care, you being anyone in America, for whatever your condition is, that you are entitled to treatment. And no provider who accepts Medicare funding can deprive you of the care that you need to preserve your life or to stabilize your health. And we're going to do everything we can to, and we have taken action against certain facilities to make sure that we enforce the law.
The administration has encouraged pregnant patients who feel they have experienced discrimination in health programs to file a civil rights complaint with your agency as part of your response to Dobbs. Has that produced any results for patients needing reproductive health care?
So we've heard a number of reports and received inquiries from a lot of folks, and we try to make sure that our Office for Civil Rights is available to them. Under Section 1557 of the Affordable Care Act, you are not allowed to discriminate against a consumer who needs health care. Regardless of what their condition is, you're not allowed to discriminate. And in this case, when it comes to the issue of contraceptive care, or perhaps for someone who's LGBTQ. So we're going to do everything we can to enforce the law. We talk to all those providers if there's a case where a discrimination may have occurred. We try to make sure that those providers are aware of what their obligations are under the law. And if we find that there's someone who's not responding, we'll enforce.
FDA is being sued in court for allowing the abortion drug mifepristone on the market. Some have said the lawsuit doesn't only endanger access to the abortion drug, but FDA's regulatory authority more broadly. What are your thoughts on the lawsuit? And given the Supreme Court's current makeup, how do you think this will play out?
So this is an interesting case. And again, I get sued a lot. I was accustomed to suing. Now I'm getting sued a lot. So I have to be careful what I say. But what I can tell you is this. Remove mifepristone and put the name of your medication in the place of mifepristone. And now you'll understand the consequences of what the Supreme Court decision means. Because so many of the medications, so many of the medical devices, so many of the therapies that you and I and our fellow Americans count on are based on the FDA's actions to let America know that that product is safe and effective for the intended use. If mifepristone, remove mifepristone, put the name of your medication, went through that process, and somehow that process is found defective, that means mifepristone, remove mifepristone, put your medication, is now subject to someone suing saying, FDA did not go through the proper process to approve your medication, and therefore it should be removed from the counter or from behind the counter. It is consequential in ways that most people don't recognize. And that's why I think there will be some sanity, at least in one of the institutions of the federal government, when it comes time to reach a decision by the Supreme Court.
I've got so many questions here. It's hard to it's hard to sort them up. You're quite popular. Is single-payer health care in our future?
Okay. I have been a single-payer advocate since I got elected to the State Assembly in 1990. And now as secretary, I'm doing everything I can to really accomplish the mission that the President put us on, to expand access to care, to make it universal. Whatever you call it, at the end of the day, not one of our fellow Americans should lack the chance to use that facility, go to that doctor when he or she needs it. It's, I think we're getting there. And I think COVID taught us that. The people that were dying from COVID, and you know this, especially those who reported this, were people who were usually a little sicker, a little older, or a little poorer than the rest of us. That's always been the case. It's just that COVID made it difficult to ignore. And so what we're seeing now is that these holes in our system really capture people we love. And the way you first address it, as I was saying in my remarks, is by starting at the beginning, at the prevention stage, by giving people access. And so will we get to universal coverage? I believe so. We're already on our way. This president has taken us farther than any president before. I don't think he's going to stop. And I hope that the Congress will have the good sense to follow the president on this, because I guarantee you the American public will, because the next time someone tries to repeal the Affordable Care Act, they're going to say to those folks, get your stinking hands off of my marketplace coverage.
All right. The FDA is going through what has been described as the biggest reorganization in its history as it proposes to revamp its Human Foods Program and its Office of Regulatory Affairs. You were mentioning the importance of food in your remarks.
Yeah.
The agency has sent its plans to your office. Have you reviewed the plans, and how do you plan on moving forward?
We've been going through this for quite some time. Again, we're elevating food. We want there to be prominence in what we consider food, how we treat food, and how you can label food. Because again, if we want people to have access to nutritious foods, to understand what it means to stay healthy, they first have to make sure they have the concept down. It is tough, believe it or not, you would believe it, to get a proper label on a product you buy at a grocery store. What is non-GMO? All those labels, sodium-free. By the way, you probably know this, right? The potato chips you buy in the US contain magnitudes more salt than they do in Europe. I did not realize that until I ate one of them in Europe, and I said, this doesn't taste the same. And they said, it's because it doesn't have the salt that you have in America. But it's intentional. And so we have work to do, so we recognize the nourishment that we put in our bodies. And so more and more, the word in Spanish is alimento. Nutrition is alimento. Ale, alimento. If you don't have good alimento, you're going to start to feel the ailment that comes from bad food. And so we're going to move aggressively. FDA has some phenomenal scientists who are absolutely committed to this. They feel like they've been empowered to really move us. And we've said to them, do not do mild.
Going back to pharmacy CEOs, earlier this week you spoke with pharmacy CEOs about the commercialization of COVID-19 drugs such as Paxlovid. Pfizer has set the price for a course of Paxlovid at nearly $1,400. While HHS has negotiated with Pfizer to ensure access to the drug, what concerns you about equitable access to COVID therapeutics?
So we negotiated at HHS an agreement with Pfizer to make Paxlovid available to the American public, because we're now transitioned, we're out of the public health emergency. We no longer have the same authorities. We're no longer administering and distributing and watchdogging as much the vaccines and the treatments from our shop, because we're returning to where it usually stands, in the commercial market. And as we transition to the commercial market, we negotiated really hard with Pfizer to make sure that Paxlovid would be available to Americans the way they were accustomed to it. So if you are on Medicaid, if you are on Medicare, if you are under or uninsured, you will continue to have access to Paxlovid, zero cost, zero cost. If you have private insurance, it should not cost you much money, certainly not more than $100. But you see what Pfizer has priced it at. In that naked, cold world where the market drives the result, that's what you would pay. And here's the mind-boggling part of this. American people who've been getting Paxlovid for quite some time, they don't recognize that they've just saved themselves $1,400. But here's the worst part about that, going back to prevention. I wish my mom were talking to these guys. $1,400 for Paxlovid. You know how much Pfizer's vaccine costs? $20 or $30. You get the vaccine, you probably don't need Paxlovid. Either way, President Biden made a commitment. You're going to get what you need: vaccine, treatment. Now, that's till the end of the year. Then we hit the brave new world of commercialization, and let's see what happens. And that's why we need to get people insured, so they're not paying an outrageous $1,400 for a treatment they may need to stay alive.
Staying on the COVID topic, where do we stand as a nation on the COVID pandemic? Is it over? Will it just be one more virus, or do we still have work to do? I got my vaccine, I think in November. Do I just keep my mask at home and not worry about it?
So everywhere I go, I love to do this. I love to ask, how many of you have taken your latest vaccine? on COVID. Well, good, and you're willing to volunteer. That's nice. Thank you. I did that. I was at the editorial board at the San Jose Mercury recently, and I got asked a question about what's the status of COVID, what are you doing? And I said, well, I can answer by first you telling me how many of you here have gotten your vaccine. Everybody had vaccinated, so that was good. It's great to see the number of hands that have gone up. COVID's still with us. It's still killing hundreds of people a day. It could mutate into something very dangerous at any time. We are, through our Next Gen program, trying to come up with the next generation of vaccines to address COVID. But because Congress pared down our money that we have, we're having to limit the number of trials that we're doing to see which one is going to click, which is kind of dangerous because Warp Speed had an opportunity to fund about 6 different trials to see which treatments would work. And that's where we got Moderna and Pfizer's vaccines, along with Novavax and so forth. We're doing far less because we don't have the resources to have that big of a universe. But we're doing what we have to do. Vaccine, anybody here paid for a vaccine yet for COVID? No, not a single American. As I said, almost 700 million shots have gone onto your arms and the rest of America. $0. That's never been done before. But President Biden made a commitment. We're going to make it so that no one can refuse to get the vaccine, even though a lot of folks are refusing, but not for the right reason. So get vaccinated. It works. May not stop you from getting the infection. Chances are it's going to stop you from going to the hospital, and even stronger chance that it's going to stop you from dying.
You mentioned in your remarks global negotiations over how to react to the next pandemic.
Yeah.
Countries around the globe can't agree on trade. They can't agree on privacy rights. They can't agree on how to regulate tech companies. Why are they going, how are they going to agree on how to address the next pandemic?
And Mark, you hit it right on the money. Why? How? Because we never get together, except if it means your life's at stake. And that's what's going on. And we have this chance to actually, for the first time, get the global community to come together. I mean, the issues are interesting. And I love to go outside of the U.S. because you get to see it from their perspective. As I keep telling some of these countries that are not yet ready to deal, you know, America wants to see it, and President Biden is committed to seeing a global accord. But one way or the other, we're going to take care of our people. We're going to do what it takes to preserve your life. As you saw, we spent billions and billions of dollars to make sure you were okay. Then we shared with others to the tune of billions of dollars. But first, we took care of our own. We're going to do that again, no doubt. And that's what we should do. You take care of your family before you take care of your neighbors. Those neighbors sometimes don't have capacity to do as well to take care of their own. President Biden is offering them a chance to be part of a community that can share in those discoveries, share in the data, and share in the cost. I think we get a deal because it's indispensable. Because if they get sick in that country that couldn't afford to figure out how to do a vaccine, someone from that country is going to come over here, and then we'll get infected. And if it's not the variant that we got vaccinated for, you may not be safe. I think we'll get there. Just like the negotiations just a couple miles down the street. They got to make sense. You know, you really got to want to cut a deal, because you can negotiate, but then if you can't accept yes as an answer, then there's a problem. And so I think at the end of the day, we can get countries around the globe to say yes.
Speaking of pandemics, and the one that we just have mostly gotten through, a question from a federal employee in the office. There are concerns that the department will enforce a return to the office order for federal employees. Can you confirm whether the agency is planning to increase its in-person work?
Of course. I mean, everyone has a job description. We all have arrangements. If you have a telework arrangement, you know what it says. Yeah. Should I have said more? I mean,
Okay. That'll do. Can you speak to the role of emerging technologies like AI in the future of the U.S. healthcare system and in realizing value-based healthcare? And a related question, what efforts are there at HHS to put health records on the blockchain?
Yeah, so AI is a real intrigue because it absolutely opens these doors to such opportunities. But if you open the wrong door, it can be dangerous. And at HHS, we've been operating with and working on AI for quite some time. Think of so many of the devices that FDA has approved over the course of the last several years where the devices use AI. We have had to look into this for some time. Medical records, think about what AI does when it comes to communication of health data and medical records. We have to be concerned because so much of that information is precious and private. So we've been working AI for quite some time. What I've said to the team, and what I think our team has done very well, because they recognize how crucial it is for you to know that AI will be employed properly within healthcare, is we've said we need to incorporate a number of things into any AI platform. Privacy, clear technology that is transparent in how it's used, and for me, very important, equity. Equity by design, so that we don't find ourselves with algorithms that discriminate based on the inputs that were given for that formula. And we've heard the stories how certain AI platforms can identify facial features, but don't do it as well for dark-colored skin as they do for light-colored skin. If that's used to determine who gets to come in, who doesn't get to come in, who gets the money, who doesn't get the money, whatever the yes is and the no is, if you're the dark-skinned person, you're getting a lot of no's. Equity by design.
Before I ask the final question, let me take a moment to thank the organizers of today's event. They are headliners, co-team leaders, Donna Leinwan-Leger, who I introduced earlier, and Lori Russo. Today's headliner event was organized by William Pierce, as I mentioned earlier. Club event coordinator Cecily Scott Martin, club membership director Kate Helster, and club executive director DDA Sauji. And also, let's thank the kitchen staff and our wait staff for a wonderful work. Thanks to all of you for coming to the club today to participate in this discussion. Thanks to all of you who are watching on television. And it's my pleasure and honor to present to you the coveted gift that all National Press Club speakers receive, which is the National Press Club mug.
Thank you very much. It's under the limit. That helps.
And now I see we still have 2 minutes left, just a little longer than I thought. So you have some time to expound on this. The Super Bowl is Sunday. You're gonna be cheering for the Chiefs, right? Or maybe the Niners? Which one?
I was the AG of California. I represented California for 24 years in Congress. I guarantee you the weather today in California is better than it is here. So go 49ers, come on. I feel badly for Taylor and Trevor, but there will be other happy moments for them. Sunday probably won't be one of them.
Okay, we will see how that
Travis,
works out.
it's Travis. I said Trevor. Travis Kelsey.
Yes.
Taylor and Travis.
All right. Well, Secretary Becerra, thank you so much for coming to the club today.
Thank you very much.
And we are adjourned.
Thank you.